Hey, Mo. I'm studying for my MRCPs and I cannot get my head around EEGs. I know that's your field of expertise, so you wouldn't mind helping me out?
Sure thing, Marie Claire. How about we go through the basics of the EEG today? It may be useful for you guys at home too.
So, what exactly are EEGs used for?
EEGs are primarily used in the diagnosis of epilepsy, a neurological condition associated with abnormal electrical activity in the brain.
Another important use of the EEG is distinguishing organic disorders from psychiatric or functional illness. An EEG can also be used when predicting the outcome in some types of coma and to investigate sleep disorders. EEG can also be used to detect some other neurological abnormalities such as encephalitis and some types of dementia, although a definitive diagnosis in these cases is by other investigations.
So, how exactly does an EEG work? What's the science behind it?
Well, electrical activity in the brain is generated by action potentials in neurons. Cortical pyramidal neurons contribute most to the EEG signal as they have long axons and a unique orientation perpendicular to the cortex. The cell body is heading away from the surface, while the apical dendrites are heading towards the surface. As a result, the electrical fields are likely to project towards the scalp surface, ready to be picked up by the electrodes.
I've heard of a concept called impedance. Could you explain what that is?
Impedance is the opposition to the flow of current. It is measured in units of ohm. A good electrical connection between electrode and scalp is essential in the recording of clean EEG signals. A low impedance ensures that the recorded EEG signal reflects brain activity as opposed to artifacts such as noise from the electrode, the environment, or the subject themselves via blinking, muscle movement, and their heartbeat. It may be necessary to perform electrooculogram, electromyography, and electrocardiogram to eliminate those waveforms which are not cerebral in origin.
Ooh, sounds interesting. Could I get an EEG?
Sure, but first I'll need to tell you about some potential adverse effects of undergoing an EEG. Some main ones are that there is a risk of skin abrasion which can become infected. The skin can also become inflamed. You can also get a headache from the electrode cap. In this video, the EEG electrodes are placed on the scalp according to the 10 to 20 International Placement System. This method was developed to ensure a consistent protocol between studies to allow for comparison between subjects. The 10 and 20 refer to the placement of electrodes at fixed distances, or 10% and 20% from anatomical landmarks, for example, the nasion, the inion, and preauricular points, thus allowing for consideration of variations in head size. Electrodes are labelled with both a letter and a number, according to the site at which they are recording brain activity. Even numbers denote the right side of the head, and odd numbers the left. Letters refer to the area of the brain underlying the electrode. For example, F for frontal, C for central, P for parietal, T for temporal, O for occipital, FP for frontopolar, FZ for midline frontal, CZ for midline central, PZ for midline parietal, OZ midline occipital. So the first thing you have to do is measure head size. You do this by measuring from the nasion, this is the depressed area directly between the eyes, to the inion, the bony process at the back of the head. This will allow us to choose a corresponding EEG cap size. You then plug the electrodes into the correct size cap. Each splitter box has 32 electrodes, where each electrode corresponds to the number on the cap. We then clean the face, around the eyes and behind the ears using alcohol and scrub gel. This exfoliates the skin to allow a better connection with the ground electrode. Put the cap on by centering the front of the cap on the participant's forehead and then pulling the rest of the cap backwards over their head. Now adjust the cap's alignment to ensure that the CZ electrode is on the midline of the head. That's halfway between the Nasion and the Ilion. We now secure the chin strap and place the splitter box on the shoulder of the participant and fixate with tape. In order to record eye movements, an electrooculography (EOG) is performed by sticking the following electrodes to the participant's face. The vertical EOG electrodes should go above and below one eye. The horizontal EOG electrodes should go on each temple. The ground EOG electrode should go on one ear. Note: other signals may also be recorded in conjunction with the EEG as mentioned previously. Carefully push the blunt syringe tip through the plastic groove. Gently twirl the syringe to move hair away from the scalp and squeeze gel onto the scalp until the LED turns green. This means the impedance is good. Let the participant produce artifacts, blinking, looking left and right, and chewing, and explain their effects on the EEG signal. Once you are happy with the signal quality, when all or most of the electrodes are green, you are ready to start recording.
So what type of results does an EEG produce? Could you give me some examples of waveforms?
Various waveforms are recorded during the EEG procedure. I'll take you through in-depth interpretation of such waveforms another time, but a few examples are: this is a wave pattern during waking. This is a wave pattern during an absence seizure in childhood. And here is a wave pattern during sleep. Well, I hope that was useful for you, Marie Claire, and for you guys at home. Don't forget to subscribe.